This medicine has a hormone called progesterone, which helps women become and stay pregnant. It is used to increase the level of progesterone in women taking fertility treatments because these treatments tend to decrease progesterone levels. The usual dose of Endometrin Insert is 1 insert placed in the vagina 2 to 3 times a day, with the second dose at bedtime. This helps maintain the necessary progesterone levels for a successful pregnancy. Before you start using Endometrin Insert, make sure to read the patient information leaflet from your pharmacist. This medication is for vaginal use only. Follow the instructions and use the applicator to insert the suppository into the vagina, as directed by your doctor, usually 2 or 3 times a day. If you become pregnant, continue using this medication for up to a total of 10 weeks or as directed by your doctor. The dosage of Endometrin Insert is based on your medical condition and response to treatment. To get the most benefit from this medication, use it regularly at evenly spaced intervals. It's best to use it at the same times each day, to help you remember. When using Endometrin Insert, you may experience some side effects such as bloating, stomach or abdominal pain, nausea, breast tenderness, headache, drowsiness, mood swings, irritability, or vaginal discomfort. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. Remember that your doctor has prescribed this medication because they have determined that the benefits to you outweigh the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to seek immediate medical attention if you experience any serious side effects, including unusual vaginal bleeding, severe mental or mood changes, such as depression, swelling of the ankles or feet, or breast lumps. Additionally, this medication, especially when used with an estrogen product, may rarely cause very serious, possibly fatal, problems from blood clots, such as heart attack, stroke, blood clots in the lungs or legs, or blindness. Seek medical help right away if you experience symptoms such as chest, jaw, or left arm pain, weakness on one side of the body, trouble speaking, sudden vision changes, confusion, severe headache, or trouble breathing. While a serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not listed here, it's important to contact your doctor or pharmacist. And as always, if you have any concerns about the side effects of this medication, be sure to discuss them with your healthcare provider. Before starting Endometrin Insert, it's important to inform your doctor or pharmacist about any allergies you have, as well as your medical history. This includes conditions such as blood clots, liver disease, cancer, vaginal bleeding, kidney disease, heart disease, high blood pressure, seizures, migraine headaches, asthma, depression, diabetes, strokes, and high levels of fats in the blood. Endometrin Insert may cause drowsiness, and the use of alcohol or marijuana can intensify this effect. It's important to avoid activities that require alertness or clear vision until you can do them safely. Limiting alcoholic beverages is recommended, and it's important to talk to your doctor if you are using marijuana. In general, alcohol is not recommended for pregnant or possibly pregnant women due to the increased risk of harm to the baby. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication may be used during pregnancy, but only as directed by your doctor. It's important to discuss the risks and benefits with your doctor before using Endometrin Insert during pregnancy. Endometrin Insert can pass into breast milk, so it's important to consult your doctor before using it while breastfeeding. When taking Endometrin Insert, it's important to be aware of any potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Your doctor or pharmacist should be informed of all the products you use, including prescription and non-prescription drugs, as well as herbal products. It's crucial to follow their advice and not start, stop, or change the dosage of any medicines without their approval. Additionally, it's important to avoid using other vaginal products during treatment with Endometrin Insert unless otherwise directed by your doctor, as this could impact how well the medication is absorbed by your body. If this medication is accidentally swallowed, it can be harmful. In case of an overdose with serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical attention by calling 911. Otherwise, you can contact your local poison control center for further assistance. It is important not to share endometrin insert with others. Make sure to attend all medical and lab appointments as scheduled. If a dose is missed, take it as soon as remembered. However, do not take more than the prescribed daily amount. If it is almost time for the next dose, skip the missed dose and take the next dose at the regular time. Do not double the dose to make up for the missed one. Remember to store endometrin insert at room temperature, and always keep it away from children and pets. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.